This is a New York Times article from a couple of weeks ago about the phenomenon of coming back from vacation and still being burnt out. Specifically, I want to talk about this concept in regards to physicians and vacation. Because basically, I think some of the points in this article are exactly right. The answer for physicians who are burnt out is not more vacation. Because as a physician who's a locum tenens now, but I used to be full-time, vacation was awesome, but it was super stressful as well. And you might be thinking, why is vacation as a physician stressful? Vacation's when you go and relax, right? But it's getting ready for that vacation and knowing what awaits you that is a hard part. Because basically, when you're a physician in a traditional role, you have to figure out how you're going to make it so that taking this vacation doesn't totally F over your colleagues and also your patients. So leading up to a vacation, I would have to make especially sure that all of my messages, all of my lab tests, and all of my test results were completely taken care of before I left, and that the acute patients who really needed acute care because of things going on with their recovery or things like that, that there was a plan for them. And yes, obviously you're doing this on a day-to-day basis when you're not on vacation, but if you're going to be gone for a week, you have to make sure everything is perfect so that your colleagues are not taking the brunt of that when you're gone. And usually leading up to a vacation in my institution, we would also do something where you're taking an extra clinic day in preparation for that vacation so that the overall productivity and access of the clinic was not going down. And even if you have a buddy system where one of your colleagues is taking care of your inbox and sort of like making sure the messages are not emergencies, when you come back, you are coming back to a workload that is 2 or 3 times as much as normal. Think about that phenomenon of Sunday scaries, where at the end of your weekend, you're already dreading Monday and the week that is to come. It is double as a physician when you're coming back from vacation. So throughout my 6 years as an employed physician in a full-time job as a urologic surgeon, when I was going away on vacation of about a week, the first couple days, 2 or 3 days, were what I needed to sort of de-escalate, and my anxiety levels would go down and I would start to enjoy myself. But then if it was a week long, over the last 2 to 3 days, I would start to get more and more anxiety because I knew what I was coming back to. So in a week-long vacation, maybe I got about 1 day of relaxation before the anxiety started to ramp up again. And basically, what are the answers? It's probably a mixture of increased ancillary support or even artificial intelligence to help with the messages and test results and all of the administrative duties that weigh on physicians now with the advent of the electronic medical record system. And more than that, it's making sure that physicians aren't so burnt out in the first place. I'm Dan, the Darwinian Doctor. I'm a urologic surgeon, real estate investor. Follow for more.